So which of the following is the most likely diagnosis? So a 45-year-old woman presents with intermittent episodes of um, bright red blood per rectum for the past 2 months. She denies any abdominal pain, changes in bowel habits, or weight loss. On physical examination, her abdomen is soft and non-tender. Her digital rectal examination reveals bright red blood on the glove. Colonoscopy is performed, which shows a pedunculated polyp in the sigmoid colon. Biopsy of the polyp demonstrates abundant normal connective tissue and blood vessels with no evidence of dysplasia. Which of the following is the most likely diagnosis? Okay. So pedunculated, just like we said, it's the ones that are like attached.
Hmm.
Um, Definitely not anything like IBD or IBS related. Um,
So talk to me, right? So give me in your mind, right? When it, what is the most specific piece of information of this question?
the fact that it shows normal connective
Yeah.
tissue that um like it has blood vessels and there's no evidence of dysplasia.
Okay. So good. So I like that so specificity. So the thing that's most specific is always the biopsy, right? So when
Mhm.
you read that, it just shows normal connective tissue, blood vessels. And what does it mean when it says no evidence of dysplasia?
I mean, it's not like cancerous.
Good, good, perfect. So now you want to pick something that matches that, something benign that can have a lot of normal connective tissue.
I want to say perhaps because juvenile is for kids.
Okay.
So not that one. Oh my God, I'm playing it again in my head. No, I'm not doing that. I think it could be inflammatory polyp.
Okay. So this is your gut answer choice. Okay. Talk to me. Do you want to keep it or change it here?
I'm not gonna lie to you, like submucosal also it sounds good to me. However, um, the reason why I'm not going for this is just because like it just seems too normal,
Okay.
in my opinion. So I think I'm gonna go with this.
Okay. Inflammatory polyp.
I think so.
So it's
Oh,
actually submucosa. Okay. So presentation, imminent bright red per rectum, non-tender colonoscopy is this, right? Submucosal polyps, also known as mucosal prolapse polyps or fibrovascular polyps, are benign and often cause rectal bleeding because it has a lot of vascular supply.
mhm.
Adenomatous polyps, right? Potential to histologically has dysplasia, so it can't be adenomatous because remember, adenomatous polyps can lead to colon cancer. So it
Mhm.
shows some kind of dysplasia. Hyperplastic polyps, non-neoplastic polyps, usually small and found in the rectus sigmoid, histologically shows elongated straight crypts, no dysplasia, but doesn't really have blood vessels. Inflammatory polyp is a non-neoplastic polyp that occurs in the setting of
Mhm.
inflammatory bowel disease. So you said it wasn't that, so unlikely it's going to be this, right? But it
Yeah.
usually shows inflamed granulation tissue. Just means like granulation tissue means healing or inflamed tissue. Juvenile polyp, right? Usually in children, and is associated with rectal bleeding. Histologically shows dilated cystic glands filled with mucin and inflammatory cells. So the one that actually best fits here, like kind of how you were thinking between the two, is going to be your submucosal polyp.
Mucosal polyp. Okay.
Okay.
Okay.